We're tackling one of the biggest showdowns in the medical coding world, and that is the CPC versus the CCS. Think of this as the choose your starter Pokemon moment of your coding career. You can always catch them all, but you need to determine what is going to be your starting point. If you've ever wondered which certification is better, spoiler, that's not quite how this works, but there are major differences, advantages, and career paths tied to each of them. So by the end of this video, you'll know exactly which one fits your goals. Let's start with the CPC. So the CPC is only offered by the AAPC. That's the only organization that offers the CPC exam. Other credentials are offered by other organizations. So the AAPC offers the CPC, which is also known as the Certified Professional Coder. Professional in this case does not mean professional like, oh, I'm such a pro at this, like I'm just the most professional. It is actually the type of coding. So we have different types of coding, mostly four main types of coding: professional fee, outpatient, inpatient, and risk adjustment. So professional fee coding is coding for physician-based services or things that we would bill out on what we call the CMS 1500 form. So it's one of the most widely recognized professional fee outpatient coding certifications for the US. So physicians' offices, professional fee coding, E&M, surgery, same-day procedures. CPC focuses mostly on three code sets: CPT, HCPCS Level 2, and ICD-10-CM. The exam itself also includes like some med terms, some anatomy, a little compliance, some regulations, etc. So it is known as the go-to certifications for people that are entering the field because it aligns with the most common entry-level job settings. The CCS is offered by AHIMA, that is the Certified Coding Specialist, and it is the gold standard and has been for many years in inpatient coding. It is not the only inpatient coding credential. It is not the only one that employers will take, but it has historically been the top sought after one specifically for inpatient coding. So for all of those patients that are formally admitted inpatient to the hospital, that is coding for that whole hospital stay, complex inpatient surgical stays, and also includes DRG assignments, and it includes a code set that's not covered at all with the CPC, and that is ICD-10 PCS. The CCS does cover a little outpatient, but is mostly respected in the hospital environment, especially among organizations with structured health information management departments. So basically, CPC is more pro-fee outpatient, CCS is inpatient. Now let's talk about the requirements. So for the CPC, the good news is there's no strict education or experience requirements. You can sit for the CPC with no background. It makes it very beginner friendly, very easy point of entry. Now, having said that, obviously you're not going to do very well if you haven't gotten good training to sit for the CPC exam, but technically speaking, the only hard and fast requirements are that you become a member of the AAPC and you take the exam and pass it. Now, you will get an apprentice designation or CPC-A until you complete your required practical experience, but that is usually pretty manageable. I have whole videos about the apprenticeship status removal, and you can check also the AAPC website for more details about the apprenticeship's designation. Now, the CCS, people get very confused about because historically it did have some things that you were required to do before you could sit for the CCS. Now it has recommended prerequisites, but they are not required prerequisites. It's just we would prefer you do this, but you don't have to. So some of them are formal coding education or experience coding inpatient services or outpatient services, or they recommend maybe you have an RHIT or RHIA credential, or you've done some coursework in medical terminology and anatomy and pathophysiology and pharmacology and, oh yeah, medical coding. But again, AHIMA doesn't require those. It's probably going to be easier for you to pass the exam, though, if you have some of that experience. And it's the one that employers really prefer. It's not the only one they take, but it's historically been the preferred one for inpatient coding. Now, as far as the exams, these aren't things that you can study for over a weekend and pass. I will sometimes have people that will come to me and be like, Victoria, I want to learn medical coding, but I want this to be super cheap and easy. I don't want to spend more than a couple hours doing this. I hate to tell you, like, it's not that type of skill that you can just learn it with a quick workshop. The CPC exam, though, it's 100 questions. It's 4 hours long. There are some quickie questions about med-term and anatomy. There's some case-based questions. There are some scenario-driven questions. And it's testing you on CPT, ICD-10-CM, HCPCS, compliance, medical insurance questions. It is open book as far as you can bring your code books, because there's like 100,000-ish codes between those code sets, and there's no method to the madness that would reasonably allow you to memorize them. So you have to have code books or ebooks during the exam. You can't bring study guides or workbooks or anything, but you need to have your code books to look up the codes. The CPC exam is challenging, but with structured study and a solid practice routine, it is very passable, especially if you have really good training and you really commit yourself to it. As far as the CCS exam is 2 parts. It's multiple choice and medical record coding cases, and it tests ICD-10-CM as well as ICD-10-PCS, which is a totally different code set than ICD-10-CM, and it also tests CPT. There is a strong focus as well on what we call DRGs, or diagnosis-related groups, and facility inpatient coding. You have to know things like your sequencing rules. And again, it is an open book as far as code books, but the cases are long and the time pressure is real. The CCS is widely considered harder, especially because of ICD-10-PCS and the facility coding guidelines. So if the CPC exam, you consider that like a really tough workout, the CCS is like CrossFit at 5 a.m. taught by someone who has not had carbs in the past 5 years. With the CPC, as far as where you can work, oftentimes it's physician offices, multi-specialty clinics, outpatient facilities, large healthcare organizations, these big hospital systems, ASC centers. You can work in telehealth, auditing, insurance companies, anywhere within the revenue cycle. You might be coding E&M, you might be coding surgeries, you might be coding diagnostics, outpatient procedures, same-day surgeries. You can branch into auditing. There's a credential called the CPMA, which is the Certified Professional Medical Auditor. It's not too hard to skip over to risk adjustment. Risk adjustment just as ICD-10-CM, and ICD-10-CM is part of training for the CPC. Specialty coding, there's education, there's compliance. With the CCS, those career paths are typically working in hospitals, working in the health information management department. You could work in trauma centers, large health systems, you could work in consulting firms, different types of facilities, and you'll be coding those long inpatient stays. Any patient that is formally admitted into the hospital, not in observation, not in the emergency department, formal inpatient stay. And you're going to be possibly coding some complex surgical cases, ICU stays, large operative episodes, and you're going to focus too on those DRGs, those diagnosis-related groups. And some of the things you can move into eventually: inpatient auditing, CDI, clinical documentation integrity. That is huge the past few years. Health information management, leadership or management, and DRG validation roles. Now let's talk salary. Not a shock that the one that's harder tends to pay a bit more. CCS coders often earn more because inpatient facility coding is more involved and it's attached to higher pay, higher risk. Now, CPCs can close that pay gap with a lot of experience, or if they specialize, or if they move into auditing or compliance roles. So really neither of them wins the race. It really just depends on your personal lane. So really, which one is best for you? Well, the CPC is good if you're brand new to healthcare, brand new to medical coding or anything involving the revenue cycle, and you want a wide range of entry-level opportunities, or you prefer professional or outpatient coding and possibly want to get eventually into maybe compliance or auditing in that setting. Or if you just want something that's a little bit more structured and beginner friendly, the CCS is if you know, like, I want to get into inpatient coding, you know you want to work in hospitals with HIM departments, you really enjoy intense, complex puzzle-like medical cases. If you're ready for ICD-10 PCS, or you want to specialize maybe in clinical documentation integrity, although they do have CDI now in the outpatient setting as well. So there really is no supreme credential, just one that aligns with your goals. By the way, if you're leaning towards the CPC, especially as someone who's like brand new to the field, you've never worked in healthcare, one of my favorite beginner-friendly options is Preppy. Preppy partners with accredited universities. The courses are 100% online. They are super affordable, and you get all the foundational materials, including your midterm and your training materials that you need to prepare for the CPC exam. And they're not going to give you a lot of unnecessary fluff that drags it out just so they can fit it into a 2-year degree box. Also, they're not going to force you into taking out these expensive student loans that you'll wind up paying off for decades, and we love that. If you want to find out more about them and more about a career in medical coding, you can check out my free career masterclass at medicalcodingmasterclass.com. I will also link it below. So CPC versus CCS, who reigns supreme? Well, really both. They just kind of rule different kingdoms. CPC is all about the kingdom of outpatient pro-fee world, and then CCS rules the inpatient lands. You just need to pick whatever one fits your environment and your learning style and where you want to work. So whichever one you choose, you are on a solid path in an industry that genuinely needs skilled coders. Employers are really looking for credentials through either AAPC or AHIMA. Some of those other ones out there, especially ones that maybe include in your program, they are only accepted in pockets of little areas here and there, especially not for coding jobs. For coding jobs, they want credentials through AAPC or AHIMA. So if this helped you decide between the two certifications, drop a comment and tell me which one you're leaning more towards. And if you want more videos like this, hit that subscribe button. Thanks for watching, and as always, keep on coding on.